Medicare and supplemental health insurance plans can be tricky and confusing, but there are resources out there that can help you stay on the right plan and make sure you understand exactly what your plan covers. For example, SHINE is a state program specializing in helping those with Medicare. With this free, unbiased counseling, you can avoid being blindsided with unexpected rising costs and find out whether or not your current plan is the best plan for you.
SHINE stands for Serving the Health Insurance Needs of Everyone, meaning everyone on Medicare. So what the program really is to help people with Medicare to understand what it is, what it covers, what their options are related to Medicare. When it comes to Medicare, it's unfortunately very complicated. It can be very confusing. So we're here to support and help people to make informed decisions.
Once a year, everyone who is on Medicare has the opportunity to review their current plan and make a decision about whether they want to stay with that plan or whether they want to shop around and see if there's something better for them. And we always caution people not to do this once and set it and forget it. It's very much a very dynamic process. Once a year in the marketplace, plans are allowed to change prices. They're allowed to change tiers of drugs that they're covering. They're allowed to change what drugs they're covering. And so someone could be caught by surprise if they don't go to open enrollment and do the appropriate due diligence. Come the new year, they may find that all of a sudden their drug prices have shot way up, or that a drug that they previously were able to get through their plan is no longer covered.
Many times people can save hundreds of dollars or even thousands, depending on their situation. We had one person who took a lot of medications, a lot of health issues, and didn't think she could get in for an appointment. So she said, "Oh, I'm not going to come in for my appointment. I'm just going to stick with this plan that I signed up for. I'm sure it's going to be as good as any other plan." And we called her the last day of open enrollment and said, "Well, let's just review to make sure that that's going to work for you." And it turned out that a number of her very expensive medications weren't being covered by that plan. And by switching to a different plan that we were able to do that day over the phone with her, she saved over $20,000. We had another case where someone said, "Oh, I'm going to stick with my plan because the premium's staying the same." But it turns out that one of the drugs they took, the copay was going from about $7 to $90 for that same medication. So these are the kind of things that can happen.
When someone comes to us for counseling, we rely on going into Medicare's website to kind of find them in the system and confirm what medications they've been on in the past that have been listed in there, and confirm what their information is and what plan they're on currently. And the best way for us to be able to do that and confirm that everything is up to date is for them to bring their Medicare card with them. And also to bring any other health insurance cards. We often see folks that have, they have a separate prescription drug plan, and we also see folks that have retiree plans that may work as a supplement to Medicare, and they're more than welcome to come and see us as well, again, as long as Medicare is part of the package, and bring all that information with us. That way we have a full picture of what's going on as far as their health insurance coverage goes, and we can give them the right kind of guidance.
Our Metro West program is based here in Needham, and for people that want to come to Needham, they just have to either stop by the front desk here, or they can call the number 781-455-7555 and call and just ask someone at the front desk to help them to make a SHINE appointment. Again, our services are completely free, and we are, like I said, available all the time, but we do get very busy during open enrollment, so we advise that people call now to book that appointment between October 15th and December 7th.